REMPARK is a personal health device for the remote and autonomous management of Parkinson's disease. It enables the real-time identification of the patient's motor status and disease evolution, providing gait guidance and assisting the patients during their daily activities. A person with Parkinson's using the REMPARK system will be wearing waist movement sensor to enable the identification of motor status in real time, including bradykinesia, freezing of gait, and falls. Headset to provide an adaptive rhythmic auditory simulation suggesting the most appropriate cadence in each situation, thereby preventing some gait impairments. Medication pump. REMPARK technically demonstrates that an automatic drug delivery system can be remotely controlled and activated for an automatic delivery of a rescue dose of prescribed medication. Smartphone enables the collection of direct feedback from the patient, specifically relevant for recording non-motor symptoms of the disease. The smartphone acts as a main control and communication unit, as it gets processed data from sensors and controls the different actuators via Bluetooth. Data that are collected through the REMPARK system are sent to the REMPARK server, where they are analyzed by a rule engine. This intelligence built into the system will allow to accurately determine, in real time and in ambulatory conditions, users' motor symptoms and trigger courses of action, such as enabling the actuators to help the user overcome gait disturbances. The central server also gathers all the data that will allow the patient's neurologist or treating physician to monitor disease progression and evolution. The doctor will then be able to make better informed decisions about the adjustment of the pharmacological treatment of the patient, a key issue in the management of Parkinson's disease. This is Philip. He is 50 years old. As it's a sunny day, he is going for a walk and is taking the opportunity to go to the market. Philip has Parkinson's disease. As he is walking, he has a feeling of being in control of his movements. Unexpectedly and gradually, his walking begins to slow down and his steps shorten. The REMPARK sensors were able to detect this problem, and the auditory cueing is activated. Philip follows the rhythm of the auditory cues, his gait pattern returns to normal, and Philip is able to continue his walk with confidence and safety. Mark is 58 years old. He usually goes for a walk in his beautiful city. Mark has Parkinson's disease, and sometimes when he is walking, his body will freeze and he will feel as if his feet have become stuck to the ground. He experiences an involuntary shortening of stride and quickening of steps, as if hurrying forward to keep balance. This episode is called fascination, and as a result, Mark falls. The REMPARK system was able to detect Mark falling and instantly created an alert. Dr. John Turner is a neurologist. He regularly follows the temporal evolution of the disease of each of his patients, something he can do very easily and accurately through the REMPARK secure medical web interface. He recently found that the pharmacological treatment of his patient Mary might not be completely optimized to manage her condition. He observed that the duration of her on-states have been decreasing with time, so a readjustment of medication should be necessary. So he schedules an appointment. Dr. John examined Mary's disease evolution and reviewed her medication plan. As a result of this, he decided to make changes to her treatment plan. Mary is now aware of her new treatment plan.